I don't know if y'all gonna like this video, but these are the 5 mistakes that can harm patients within the laboratory. The first one I'm gonna do, pretty much lighthearted, very basic to understand and whatnot. So it would be the sample collected in the wrong collection device. For instance, let's say that you wanted to do a influenza test, but then you use a swab that's been specified for like MRSA. So therefore, we can't use that sample because each collection device is specific to a specific test, and each specific test is specific to a specimen. So therefore, you can't use the same container for poop that you can like respiratory screenings, and the same collection you can use for respiratory screenings. You can't use that for blood, and just they're not interchangeable like that. They have to be specific for the specimen and specific for the test. Number 2 would be like a mislabeled sample. So samples get mislabeled all the time. It's like the basic 101 to look out for because people make that mistake so many times. So we're always checking for patient identifiers just to make sure that these tubes are actually belonging to the patient that has the test ordered. And if it is not, then we make them recollect. We don't guess, we don't assume it has to be correct the first time or it's getting rejected, and you got to recollect. And now this patient is wondering why you stuck them multiple times. 3 would be not adhering to the volume requirements of a specific test. So say that we're testing for like HIV, and the tube is filled up halfway, but the requirement is like 1 milliliter. We cannot use anything below 1 milliliter because those are the specific requirements to make sure that we're actually giving the correct result for the test. So sometimes your nurse or your doctor, whoever is drawing you, your phlebotomist is drawing you and not giving us enough of the sample to be able to process it. So that's another mistake we find in the lab. And this one is a big one, and it just shows how important the laboratory professional is, because we have to literally advocate for these patients. So this would be number 4, is the temperature requirements not being met for the test. Let's say that we're doing an ammonia test. Ammonia has to be on ice. And if that sample is not on ice, we're not getting viable results for the patient. So therefore, you're getting results that are not the true value for that ammonia test, which means you could be treating this patient for something that it doesn't correlate. So therefore, that's another laboratory mistake that happens often, is that people are not adhering to the temperature requirements for specific tests. And this one is the biggest headache for everybody. Hemolyzed samples. That is the 5th one, is when you collect someone's blood and an improper collection makes the red blood cells burst, which means we cannot do a proper chemical analysis on someone's blood, because not only are we measuring what's in their blood, but we're also measuring the chemicals inside the burst red blood cells. And that happens a lot when nurses or medical professionals are collecting these blood samples and they're doing the collection technique improperly. Yeah, hemolyzed samples. It's the worst.